Imagine lying in a hospital bed, feeling scared and uncertain. A doctor explains your condition and next steps, but the words come fast and technical. You nod along, pretending it makes sense, even though questions are swelling in your head that you can't quite voice. This isn't unusual. It happens quietly in hospitals and clinics every day. It's not only about words getting lost in translation. It's about the healthcare system built on assumptions that don't match the reality of many lives. And so, during National Minority Health Month, we have a chance to look closer, not just at the people affected, but at the very design of the systems meant to help all of us. For too long, healthcare has been shaped around an imagined typical patient, someone who easily understands complex instructions, speaks dominant language fluently, and whose personal background, beliefs, and daily habits fit neatly into what the system expects. That ideal patient does not exist. Instead of building around real human differences, we often prioritize smooth operations over genuine understanding. We focus on schedules and routines rather than the full person in the bed. So, true understanding of health information isn't an optional extra. It determines whether someone can actually participate in their own care. So, language support isn't a luxury service. It's a basic necessity, as fundamental as having working equipment or trained staff. So, being sensitive to someone's cultural background isn't a short workshop topic. It's the foundation for building real trust during someone's life's hardest moments. Diverse representation shows up in more than staff photos. It appears in the practical details like the meals offered, the kind of spiritual support available, and how information about risks and recovery is shared in ways that actually connect. So, consider Mike, a long-haul truck driver recovering from, say, heart surgery. The care team explains discharge instructions, filled with medical jargon. He nods to avoid seeming difficult, but once he gets home, he struggles to follow the plan because it was never broken into simple, everyday terms he could truly absorb and remember. Or let's say we think of Lan, a grandmother who recently immigrated. After surgery, the hospital meals don't align with the lighter, familiar foods her body and traditions recognize as healing. So she picks up the tray, feeling disconnected from the care around her, and her recovery energy stays low. Or let's say someone named Maya, a young woman healing from surgery. In a moment of deep vulnerability, she asks for spiritual guidance tied to her tribal traditions and community. Instead, she receives a standard option that does not resonate, leaving her and her family feeling that an important part of who she is was overlooked in her healing journey. National Minority Health Month reminds us that these challenges are not small or separate issues. They reveal whether our healthcare truly serves the wide range of real people or stays anchored to narrowed assumptions. No one should have to reshape or explain their background to receive care that feels respectful and clear. So when we pay attention to these deeper patterns, we see an opportunity to build systems that work better for those long overlooked ends up improving care for every patient. And so the encouraging reality is this: when we redesign healthcare with the needs of historically overlooked groups in mind, the result is care that feels more straightforward, that feels compassionate and successful for people from all walks of life. Respect and dignity should be part of the foundation of how care is organized, and not just something patients must fight for when they are already struggling. This goes beyond simple awareness or good wishes. It requires intentional, thoughtful redesign of everyday systems that shape healing. And so, this National Minority Health Month, let's move past surface level attention. Let's move towards, let's examine not only which groups face extra hurdles, but how the systems themselves were shaped and how we can improve them together. Whether you work in healthcare, support patients, or simply believe in fair treatment, your perspective can help drive change. And so what's one practical improvement you'd like to see in hospitals or clinics to make care feel more human and inclusive? Share your thoughts in the comments section. And if this message resonated, please like, share, and share it to so many more people, or so more people to join in the conversation. Thank you for watching. Let's keep building a healthcare system that truly sees everyone. And until next time, I remain Toby of the Metamorphosis with Toby. Enjoy.